Ladies and gentlemen, have you ever wondered why your body feels drained, no matter how much you sleep, how healthy you eat, or how much you try to rest? In this video titled, Why You Feel Tired All the Time After 50, we're going to uncover the often missed causes of this constant fatigue. And it's not just about aging. What if the very routines you trust, like your favorite morning habits, your sleep schedule, or even the way you hydrate, are quietly robbing your energy day after day? And what if just a few simple shifts could restore that clarity, strength, and motivation you haven't felt in years? This isn't guesswork. We'll explore the science behind your brain's energy regulation, how hormones shift after 50, and why your body may be signaling distress in ways you never expected. But we'll also keep it deeply personal, calm, clear, and emotionally grounding, because feeling tired all the time isn't your fault, but understanding it. That's the first step toward change. So stay with us, because in the next few minutes you might finally understand what your body's been trying to tell you all along. Have you ever walked into a clinic for a routine checkup, feeling healthy and hopeful, only to leave with a strange sense of worry you didn't have before? It's more common than you think. Many people go in for peace of mind, but come out with test results that spark stress, confusion, or even panic. What if the very tests we rely on to protect our health are sometimes quietly increasing our risk for something as serious as a stroke? It sounds hard to believe, but this hidden connection is real, and understanding it might just protect your brain and your future. There's no doubt that routine testing has its place. It can detect problems early and save lives. But in some cases, when these tests are done too frequently, without real need, or interpreted without the full picture, they can backfire. Your body is a delicate system, and even the smallest disruption, like sudden medication changes, unnecessary imaging, or emotional stress from unclear results, can throw your balance off. Especially after age 50, your blood vessels become more sensitive, and your nervous system reacts more strongly to stress. This is where the stroke risk begins to rise, often without warning signs. The truth is, most of us trust the process without questioning it. We believe if a test is offered, it must be necessary. But the healthcare system doesn't always slow down to consider the long-term impact of repeated scans, excessive monitoring, or borderline results that lead to aggressive treatment. Inflammation can increase, blood pressure can fluctuate, and your brain, which depends on steady oxygen-rich blood flow, becomes vulnerable in ways you may not even feel until it's too late. You deserve better than that. You deserve to understand what's really going on in your body, not through fear, but through knowledge and balance. This video isn't here to make you doubt your doctor or reject medical care. It's here to help you become an empowered part of your own wellness journey. Because when you know how certain tests, done too often or without full understanding, can affect your brain, you start making calmer, clearer decisions about your health. In the next few minutes, we'll explore 6 common routine tests that may silently raise your stroke risk when not handled with care. We'll talk about how they affect your body, why the risks aren't often explained, and most importantly, what you can do to protect yourself. You'll walk away with practical steps, emotional clarity, and the kind of peace that comes from truly understanding your own health. This is about staying safe, staying strong, and trusting your body's natural rhythm again. It's never too late to control, not through fear or pressure, but through gentle awareness. Let's take the first step together toward a clearer, calmer path to long-term brain and heart health. Because real healing begins with understanding, and you're already on the right path just by listening. One of the most commonly overlooked sources of silent stress on the body comes from the tests we assume are safe because they're so routine. Take CT scans, for example. They're widely used, quick, and effective for certain diagnoses, especially in emergencies. But when they're done without a strong medical reason, just to be cautious or to rule something out, they may cause more harm than good. That's because each scan delivers a significant dose of ionizing radiation to your body. And while one scan may not seem like a big deal, repeated exposure adds up over time, especially to tissues that are sensitive, like blood vessels and brain cells. Radiation doesn't just vanish from your system, it leaves a trace, small but meaningful. It can slowly damage the lining of your arteries, making them more prone to inflammation and plaque buildup. This process stiffens the vessels that carry oxygen-rich blood to your brain. Over months or years, this damage can quietly increase your risk of a stroke, even if you feel completely fine. You may not notice the change happening, but inside, the stress accumulates. Especially as we age, our cells have a harder time repairing themselves from repeated exposure. It's important to remember that not all medical tools are harmful, but they must be used wisely and only when truly needed. If you've been offered a CT scan for something like a mild headache, a recent fall without symptoms, or just for peace of mind, it's okay to ask questions. Could an MRI be safer in this case? Are there other ways to monitor my condition? Simply having that conversation can protect you from unnecessary harm. It shows strength, not resistance. Your health isn't just about what tests you take. It's about how your body responds to every intervention. Stress, even the subtle kind caused by medical worry or radiation exposure, can affect your sleep, your energy, your mood. And all of these influence your stroke risk more than you might realize. When you feel calm, supported, and clear, your nervous system relaxes, your heart rate stabilizes, your blood pressure lowers, and your body begins to heal. If you've had several scans in the past, don't panic. The body is resilient. You can support your recovery with small daily choices, staying hydrated, eating antioxidant-rich foods like berries and greens, and moving gently every day to support circulation. These habits help your body clear oxidative stress and restore balance. Remember, being proactive doesn't mean doing more. Sometimes it means stepping back and asking, what truly serves my health right now? Less testing, when appropriate, can mean more healing. You have the right to understand, to pause, and to protect yourself. Let this be a gentle reminder that your wellness journey is not about urgency, it's about intention. And that begins by treating your body not like a machine to be scanned, but as a living, breathing system that needs care, not constant checking. As we begin to understand how certain tests may unintentionally increase stroke risk, it's also important to look at how we use those results in daily life. Blood pressure is one of the most common things we monitor, especially as we get older. It's understandable. High blood pressure is a major risk factor for stroke, and checking it regularly seems like a responsible step. But for many people, especially those who already struggle with anxiety or health worries, frequent self-monitoring can quietly backfire. What starts as a helpful habit can quickly turn into a cycle of fear and reaction that places even more stress on the body. Every time you check your blood pressure, your mind starts to anticipate a number. If the number is slightly higher than expected, your heart may race, your breath may quicken, and your body moves into a stress response. That stress alone can raise the next reading, creating a loop that feeds itself. Over time, this pattern may lead to unnecessary medication adjustments, increased side effects, and a sense of emotional instability. The nervous system becomes overactivated, and your body never gets the chance to fully relax. This state of chronic tension, even if mild, can subtly elevate your risk of stroke by constantly tightening blood vessels and raising inflammation levels. That doesn't mean blood pressure isn't important. It absolutely is. But how and when we measure it matters just as much as the numbers themselves. Instead of checking multiple times a day or every time you feel uneasy, try setting a consistent schedule, perhaps once or twice a week at the same time when your body is calm and rested. Sit quietly for a few minutes before taking the reading. Breathe deeply. Approach the process as a form of self-awareness, not judgment. This small shift in intention can make a big difference. Also understand that one elevated reading doesn't mean something is wrong. Blood pressure naturally fluctuates based on your posture, emotions, sleep quality, and even the time of day. What really matters is your overall pattern over time. And that pattern is shaped much more by your daily habits than by isolated numbers. Sleep, movement, hydration, and emotional stability have more power than any monitor. Trust those anchors. If you've been feeling overwhelmed by tracking your blood pressure or discouraged by the numbers, take a breath. You are not broken. Your body may just need a break from constant surveillance. The path to healing isn't paved with worry, it's built on consistency, trust, and gentle care. When you shift your focus from control to connection, your body begins to respond with calm. And in that calm, your brain and heart find the space to heal. There is strength in slowing down. There is wisdom in knowing when to pause. Your health journey doesn't have to be a chase. It can be a return to balance, one peaceful choice at a time. When we talk about routine health tests, cholesterol panels are among the most familiar. They're often one of the first results we look at during a checkup, and seeing a number labeled high can trigger immediate concern. But just like with blood pressure, these numbers are only one part of a larger picture, and reacting too quickly or too aggressively can sometimes create more risk than relief. What many people don't realize is that frequent cholesterol testing, especially when paired with fast decisions about medication, can subtly disrupt the body's natural balance in ways that affect brain and heart health more than we think. Cholesterol itself is not the enemy. It plays a crucial role in building hormones, supporting brain cells, and helping your body repair itself. The goal isn't to eliminate cholesterol, it's to understand the full context of your levels. Unfortunately, standard panels often focus heavily on LDL, the so-called bad cholesterol, without considering ratios, lifestyle, or the body's current state of stress. When these numbers come back slightly high, many people are quickly placed on medications like statins, sometimes without a clear conversation about the pros and cons. While these drugs can be life-saving for some, they're not without side effects. Especially when used long-term without lifestyle support, statins can lower more than just LDL cholesterol. They may also reduce levels of CoQ10, a nutrient your body needs for energy production in the heart and brain. When this is depleted, you might start feeling more tired, foggy, or achy. These subtle shifts can make daily life harder and lead to reduced activity levels, higher blood pressure, and even emotional strain. All of this adds up to a greater stroke risk, even if your cholesterol numbers look better on paper. It's essential to ask questions. What's your overall cardiovascular risk? What are your triglycerides and HDL doing? How are you sleeping? Are you inflamed? All of these pieces matter just as much as the number on your lab report. And sometimes small shifts in movement, nutrition, and sleep can lower your cholesterol in a healthier, more stable way than medication alone. Walking for 30 minutes a day, choosing foods that reduce inflammation, practicing mindful eating without pressure or fear. These are powerful tools your body already knows how to use. If you're already taking cholesterol medication, don't stop without speaking to your provider, but do feel empowered to discuss your full picture. Ask if your current levels justify the dosage. Explore adding back CoQ10 under medical guidance. And remember, the goal is balance, not perfection. Your body doesn't need to be managed. It needs to be supported. Your brain and heart will thank you for every calm, conscious step you take. In the end, understanding your body means going beyond the numbers. It means listening closely, asking thoughtful questions, and trusting that with gentle care, you are already moving in the right direction. As we explore the deeper impact of routine tests on long-term health, there's one area that often goes unnoticed but deserves more attention: how inflammatory markers are used and misunderstood. Tests like C-reactive protein, N, and erythrocyte sedimentation rate are helpful tools, but only when used in the right context. They were designed to give insight into whether your body is fighting off infection or experiencing inflammation, but when these tests are done without symptoms or repeated too frequently, they can cause more confusion than clarity. That confusion can lead to a cascade of decisions, extra scans, new medications, even invasive procedures, all driven by numbers that don't always reflect a true health emergency. The problem with inflammation markers is that they are nonspecific. They can rise for many reasons: a recent cold, poor sleep, emotional stress, or even a heavy meal the night before. These numbers fluctuate just like blood pressure and cholesterol, and without symptoms to guide interpretation, they don't tell us much on their own. But seeing a high result can cause unnecessary worry. That worry leads to stress. And that stress, if left unchecked, raises your blood pressure, tightens your blood vessels, and puts your brain and heart on alert, all key contributors to stroke risk. If you've ever been told your inflammation levels are slightly elevated and you felt fine otherwise, it's okay to ask for perspective. Ask if the elevation is significant or simply a passing change. Ask whether your symptoms match the test results. This gentle questioning is not about doubt, it's about balance. It keeps you grounded, and it helps prevent the overuse of treatments like steroids, which, while effective in some cases, can raise blood sugar, increase blood pressure, and weaken your immune defenses if used unnecessarily. Instead of relying on inflammation markers alone, turn your attention inward. How do you feel day to day? Is your body trying to tell you something through fatigue, joint aches, or mood shifts? Or are you moving through your life with relative ease? Your own experience is often the best guide. And when something truly needs medical attention, the signs are usually more than just a number on a chart. Support your body's natural ability to manage inflammation by returning to what nourishes you. Eat foods that calm the body: fresh vegetables, healthy fats, and clean proteins. Sleep deeply and regularly. Breathe slowly throughout the day. Walk in nature, even for just a few minutes. These small choices create a powerful shift. They lower inflammation more effectively than panic or pills ever could. The goal isn't to ignore information, it's to understand how to use it wisely. When you treat test results as one part of a bigger picture, you build a healthier relationship with your body. And in that space of awareness and calm, your risk of stroke gently decreases, not because of fear, but because of trust. Trust in your own ability to care for yourself with intention, compassion, and clarity. When it comes to protecting your brain and heart, it's not just the obvious choices that matter. It's also the smaller, often unnoticed routines that shape your internal health over time. Two of the most misunderstood tests in this category are thyroid panels and blood glucose checks. While both are valuable in the right setting, they can be overused, misinterpreted, or acted upon too quickly, especially in older adults. When this happens, it creates ripple effects in your body's chemistry, energy, and emotional state, ripples that can quietly raise your stroke risk without warning. Let's start with thyroid testing. Many people, especially as they age, have thyroid-stimulating hormone, TSH levels, that shift slightly. These shifts are not always dangerous. In fact, for older adults, slightly higher TSH levels can be normal and even protective. But in a system focused on numbers, a small elevation often leads to a prescription. The result? A dose of thyroid hormone that may be too strong, pushing the body into a mild state of overactivity. You may feel more alert at first, but this fall, energy comes at a cost. The heart may beat faster, blood pressure can rise, sleep can become fragmented, and the body is placed under more metabolic strain than it needs. All of this creates an environment where stroke risk slowly increases, even if you feel fine. The same caution applies to blood glucose testing. For people with diabetes, regular monitoring is essential, but for others, frequent checks, especially without clear reason, can lead to worry, confusion, and extremes in behavior. A single reading that's slightly above normal might lead someone to skip meals, avoid healthy carbohydrates, or overcorrect with intense diets. These reactions, though well-intentioned, can spike cortisol, cause sugar crashes, and lead to emotional and physical stress. Your body needs steady nourishment. It needs a rhythm, not fear. If you've had these tests recently and felt unsettled by the results, know that you're not alone. Many people are navigating the same questions. It's okay to take a breath and ask for clarity. Were the changes significant? Are there symptoms to consider alongside the numbers? What other lifestyle factors might explain the shift? These gentle questions help you see the full picture, and that picture often points to a more balanced, less rushed approach. Rather than over-testing, shift your focus to everyday regulation. Eat balanced meals that keep your energy stable. Prioritize rest, even if it means saying no to things that drain you. Move your body in calming ways that bring circulation without pressure. These simple steps speak directly to your nervous system, telling it that you are safe, that your body is supported, and that healing is happening. When you honor your body's quiet signals and resist the pressure to over-monitor, you give yourself the gift of peace. And in that peace, your stroke risk gently fades, not through fear, but through thought. Full, compassionate care rooted in self-trust and lifelong wellness. As we age, it's natural for our bodies to communicate in quieter, more subtle ways. One of the most overlooked signals is fatigue that seems to linger no matter how much rest we get. This kind of tiredness isn't just about being sleepy. It's often your body's way of asking for deeper care. Sometimes it's nutritional, sometimes it's emotional, and sometimes it's a combination of both. The body speaks through energy levels, and when it feels deprived of something essential, whether it's hydration, magnesium, emotional safety, or restful sleep, it sends that message as a gentle, ongoing sense of exhaustion. Listening to these signals without judgment is one of the most compassionate things you can do for yourself. Many people over 60 begin to mistake low energy for the inevitability of aging. But in truth, persistent fatigue is rarely just a sign of getting older. More often, it's a sign of missing balance, maybe in your diet, your sleep, your daily rhythms, or even the thoughts you allow to circulate in your mind. And the good news is that each of these areas can be gently adjusted. You don't need to overhaul your life overnight. Small, consistent shifts in your daily habits can send new signals to your brain and body that it's safe to recover, safe to restore, and safe to thrive again. For instance, the rhythm of your day plays a critical role in your energy levels. Your brain thrives on routine, especially as you age. Going to sleep and waking up at the same time each day regulates your internal clock, improves the quality of your sleep, and allows your body to access deeper stages of rest. These deeper stages are where cellular repair happens, where your immune system recharges, your memory consolidates, and your emotional resilience builds. Without consistent routines, your sleep becomes shallow and your energy begins to drain, one quiet day at a time. Movement also matters. Not intense workouts, but gentle, consistent motion. A slow walk, stretching, or even standing up more often during the day helps increase blood flow, deliver more oxygen to your brain, and improve your mood. The less we move, the more our body begins to shut down the systems that support vibrant energy. But when we move with care and purpose, even in small ways, we send our bodies the message that we're still engaged, still alive, still worthy of strength. Hydration is another quiet but powerful source of vitality. Even mild dehydration can cause confusion, fatigue, and muscle weakness. The brain is over 70% water, and when it lacks hydration, the signals that govern mood, memory, and energy slow down. Drinking enough water, especially in the morning and throughout the day, is one of the simplest ways to nurture alertness and calmness at the same time. You are not meant to feel constantly drained. Your body is capable of so much more than just getting by. By meeting its needs with kindness and consistency, you invite your energy to return in gentle, steady waves, restoring the quiet power that was always yours.